today. I'm going to be helping you with any questions you might have about your medicines. What did the doctor give you?
I don't know. I can't read his writing.
Yeah, well, that's a common problem, believe me. What we have here is a script for Augmentin, 500.
Does that come in one of those geriatric forms, generic forms?
Oh, yeah. Actually, it does, and that's going to be, so this is the brand name, Augmentin. But what you're going to get instead is the generic brand. I assume it will cost you a lot less.
Good.
Yeah, okay. Sure. And, so that's going to be called amoxicillin with clavulanic acid.
With what?
Yeah, clavulanic acid. It's something that makes it more effective.
Does that make me see things or anything?
No. Well, look, but that's a good question, and, we're definitely going to have to talk about, like, what could happen.
All right.
Okay? So what we have here is your antibiotic, and we're going to talk about what you're going to use it for. What did the doctor say that you were getting this prescription for?
Infection.
Okay, it's like a sinus infection maybe?
Something going on up there.
Okay, well that's a really common thing for this to be prescribed for. So what you're going to do is you're going to take these tablets. You're going to take one a day, one at a time, twice a day, and it's going to be like every 12 hours because it's going to be most effective if you take it on a regular basis. So for example,
do I need to set my alarm clock and wake up in the middle of the night or something to take it?
Well, I wouldn't do that if I were you. I would say, whatever time. What time do you maybe get up in the morning and eat breakfast?
About 6:37.
Perfect. So you could take it at 6:37 when you have your breakfast, and then again in the evening at 6:30 or 7 when you're maybe having your dinner. And it actually works out really well because with this medicine, you're going to find that it's going to be most effective if you have something on your stomach. It's going to help to absorb the medicine. So, there again, we're hoping to make your infection go away faster. And then the other thing, too, is you want to make sure you take this medicine until it's completely gone. All the tablets are gone, even if you're feeling better. Make sure you take it till it's gone, okay? Again, that's going to help you to get better. And, if you don't, then it's possible that you could end up with a secondary infection. It could come back, and it could be even worse. And you don't want that, right?
Right.
Yeah. Okay. So, if you miss a dose, what we're going to talk about now is if you miss a dose, what you do next. All right. So you're going to want to take that dose just as soon as you can remember to. Now, of course, if you're going to be, like, say, for example, you don't remember it till 5 in the evening, you don't want to take it at 5 and then again at 6:30 or 7. At that point, you've just missed it, and you just need to go ahead and take it at your regular time and then take it again in the morning and just get back on track. But it's really important that you try to stick to these dose times. That way you can get better.
Let me see who this is.
Okay.
All right, go ahead.
Okay. So then we have, I wanted to ask you, what your doctor, what did he say that, might happen with this medicine? What would its effects be?
Get rid of my infection. That's all he said it would happen.
Okay, well that's absolutely the,
Is there anything else it'll do?
Well, there's obviously the benefit of the medicine, which is to get rid of the infection.
You're pretty smart.
Thank you. And then, of course, there's the side effects, which, most medicines do have some side effects. And in this case, we're talking about potentially some nausea, diarrhea, and maybe even a rash.
A rash?
Yes, a rash. Like on your skin.
Oh, yeah.
Yeah. But, of course, then that's not something you could bank on happening. It's just a possibility, okay? Plenty of people don't have that problem.
All right, good.
All right. Okay. So now, something else, too, that we want to talk about just quickly, I know that, we've been here a little bit now, but it's, how you store your medicine. With some medicines, it's really important that, you take special care of it, just like it's taking special care of you. But in this case, it's pretty easy, low-maintenance thing to take care of, and you just want to keep it at room temperature.
Just keep it next to my razor or something so I can take it every morning in the bathroom.
We're bored.
Can't you see that I'm talking to the pharmacist here?
Okay.
I'll be out there in a minute.
Okay. We'll be done in just a minute, girls.
Okay.
All right? Well, that should be actually fine. The important thing here is that it's at room temperature and that you don't have it extremely cold or extremely hot. I think that probably in a high moisture area like the bathroom, that's not going to be the best, but, it's not the worst either. Just make sure you keep it at room temperature.
All right.
Okay? supervising physician and myself, we're all here for you to help you out with anything that you might have as far as questions, or if something comes up and you think, oh, yeah, it's weird, maybe it's a side effect related to the drug, anything like that at all, you're going to want to get in touch with us and, give us a call, see what we can do to, help you figure it out. Now, as far as, what we've talked about, can you tell me, just briefly, make sure I relay this to you clearly, how are you going to take the medicine?
I didn't realize it's going to be a test.
It's not a test. It's just me making sure that I was clear and telling you.
It's an antibiotic. I take it about every 12 hours. Keep it at room temperature. Take it with food if I can. Is there anything else I missed?
No, that's really great.
Good.
That's a really important stuff.
You must have done a good job then, huh?
I hope so. That's what I want to do. I want to help you get better.
Well, I better go get my daughters before they get out.
Okay, that sounds good. Well, you know what? It was really great meeting you, Mr. Bailey.